So my name's Dr. Luisa. I'm a consultant psychiatrist. I've been a psychiatrist now for about 15 years or so. My specialty is adult mental health and also addictions or substance misuse. With PTSD, post-traumatic stress disorder, there has to have been an acute stress response to some sort of traumatic event, but that stress response is lasting longer than 4 weeks. So there's a persistence of that stress response. Now, the stress response can manifest itself in lots of different ways, but I guess typical features would be things like the flashbacks or reliving the traumatic event. That can be triggered by things that remind you, or similar spaces, for example, or people or sights or smells can trigger those flashbacks. People can be very hypervigilant. So what that means is just very acutely aware of what's going on around them and their surroundings, and sort of they may struggle to focus and concentrate because they're so focused on what is happening and what's moving and happening around them. There can be some hypersensitivity as well. That can be sensory hypersensitivity, so sounds and sights and smells can feel very overwhelming and extreme. People can struggle with insomnia and nightmares. They can also be quite irritable and angry. They can have sort of like low frustration tolerance, and partly that can impact on their relationships and their ability to interact with friends and family. They can become quite socially withdrawn and struggle in sort of like crowded spaces and just going out and doing normal things like going to the shops, etc. With PTSD, there can be associated depression and anxiety, unfortunately, and people can, become so depressed and things that they feel like self-harming, or, perhaps even start contemplating suicide because the symptoms are just so, pervasive into their everyday life. We would need to focus on pharmaceuticals first. So these are often in the realms of antidepressants, mood stabilizers, medications to manage anxiety, essentially. Trying to help you get restful sleep as well is really, really important, because if you can get restful sleep, it's much more easy for you to manage your symptoms during the day, whereas if you're exhausted all the time, it just makes everything during the day much, much worse. So that's the sort of the pharmaceutical routes. Again, medical cannabis is coming up as being a treatment for PTSD that people are finding particularly useful. Again, just helping calm down the hyperarousal, the sensory overstimulation, like managing the emotional numbness that sometimes people can feel, managing the insomnia and reducing nightmares. Now that one's particularly important in terms of, people sort of reliving or being re-traumatized by their PTSD. So if we can reduce their nightmares, because medical cannabis can sort of interfere with your REM sleep. So REM sleep is usually where you dream. So if it can interfere with that, it can just lessen and reduce, the intensity and the frequency of nightmares for people. And if panic disorder is associated with their PTSD, if people have experience of knowing when the panic is coming on, sometimes people, have an awareness that a panic attack is coming on. The medical cannabis can just help avert and divert away from that.